Welcome everybody to my Poop Tip Wednesday. Yes, I'm sorry I could not make it on my live stream yesterday. I actually had a birthday party that I had to host for a family member, but sorry I couldn't make it. But I want to thank you guys for joining me today. So we have a lot of great topics in today's video. Number one, we'll talk about fatty liver. Is it reversible? What is going on there? What can you do to get this taken care of for you? Number two, we'll talk about exactly why does your back maybe hurt when you use the restroom. You may be surprised by that answer. Number three, we'll talk about fiber, everyone's favorite prebiotic, which is it's mine as well. Why some fiber is great for you, but other fiber makes you worse with bloating, distension, and what's going on there. We'll talk about why your poop could be small or having difficulty using the restroom. And lastly, we'll ask, is it normal to poop maybe 1 or 2 times per week? Yes, all that and more, and your live questions on today's Poop Tip Wednesday. Guys, let us go ahead and talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Alright, so once again, I want to thank you guys for joining me today. And if you have a live question you want me to answer, comment down below. Sean, it's great seeing you. Amaral, it's good seeing you. And Carol, it's good seeing you guys as well. Thank you guys for watching on the live stream. So if you want to have your question answered, number one, comment on the live stream. And also number two, don't forget to subscribe to a weekly newsletter where you can send me a direct question and I can answer that or at least have it on the next Poop Tip Tuesday. Alright, let us go ahead and begin. So question number one, is fatty liver disease reversible? So let me know in the comments, have you heard about fatty liver disease? Do you know what this is? Or do you know somebody who has this? So what this basically is, this is fat that accumulates in the liver for a lot of different reasons. The most common reason being just fat around the belly. If you have fat around the belly, that fat will go into the liver and you can see inflammation that can occur. And over time, that inflammation can end up leading to liver disease, and for some people, even liver failure. But the second most common reason is alcohol. Alcohol can also cause fat to accumulate in the liver. Alcohol is not good for your liver, and for some people, even small amounts of alcohol can be enough to cause serious damage in your liver. So the question is, what can you do about this? So there is a point in time when we can intervene when it comes to fatty liver disease, and it can be reversible in the vast majority of people. So it is not a end-all be-all if you actually end up having fatty liver disease. Now, what can you do to reverse this? So number one, obviously diet and weight loss plays a significant role when it comes to reversing fatty liver disease. And there are a lot of foods that are out there that can really help out. I have a lot of videos on them, but in general, what we know based on the most recent data is a diet that's high in fruits and vegetables by far can help decrease inflammation in your liver. So I stress to my patients, as much as you can, go on a vegetarian diet as much as you can. Now, I will tell you, I personally have experienced patients in my clinic who went on a vegetarian diet who had severe inflammation and then it went away. It reversed on its own. It works and it works effectively. Tip number two is coffee. Now, black coffee has shown in multiple clinical trials to help out with fatty liver disease. Now, this is not the yummy cream-filled coffee with lots of sugar, lots of cream, all sweet. It is straight up black coffee. 2 to 4 cups of black coffee, either decaffeinated or caffeinated, has been shown in multiple clinical trials to help decrease inflammation in the liver. Number 3 is minimizing the amount of carbohydrates in your diet. So pizza, pasta, bread, potatoes, rice, tortillas, yes, all that. If you can minimize that, you're going to reverse your liver. And then exercise, exercise, exercise. Even going out for a walk, not doing any type of exercise, not doing anything physical. The physical act of moving about in and of itself can help decrease inflammation and make your liver reverse and get it back to normal. Now, the problem is there are plenty of people who don't realize they have fat going in the liver, and they know that, and they don't realize what's going on. And going to your question, Sandra, how do you know if you have fatty liver disease and what are the symptoms? Well, here's the issue, Sandra, is that there are no symptoms. Now, very uncommonly, Some people can have maybe some vague pain around the liver. You'd be surprised your liver doesn't really produce a lot of pain fibers that are there. And so there really are no symptoms. So you may not even know that. And I will tell you, you may have some of the risk factors for fatty liver disease. If you have diabetes, if you have hypertension, if you are obese, if you have problems with your blood sugar, you may be at risk for having fatty liver disease. And you need to have your doctor check in either an ultrasound or get some blood tests on your liver to see if you have that. Because if you do, you need to come to see one of us to see how bad it is, what the extent that it could be, and also what we can do to get this reversed. It's a great question, Sandra. All right, question number 2. Why does your back hurt when you poop? Let me know in the comments down below if you felt this or if you know somebody who's had this issue where their back just hurts whenever they use the restroom. Well, one of the reasons is that your colon actually goes to where your back is. Part of your colon is where your back is at, and it kind of goes around that area. And so that sensation of having that pain whenever you have a bowel movement could be that stool trying to pass through what's called the sigmoid colon, which is part of the colon towards where your back is at. And that's actually that stool physically going through that turn, because there's a tight turn there to allow it to go into the rectum to eventually be pooped out. And that may be a very common reason why a lot of my patients who have constipation also complain of back pain. Now, you can also have back pain because you have back pain. That may be it. It may be the root cause. But if you have back pain that is related to constipation, it may be the fact that part of your colon is towards the back, and that turn as it tries to go through that twist can be the reason why you are having that pain. All right, question number 3. I had a patient who asked me this question actually just the other day, who said, "Hey, Dr. Islam, I get constipated sometimes, but eating fiber makes me more gassy. What is going on? What do you need to know about fiber?" So this is a very common issue that we see for a lot of our patients who try to introduce fiber, because fiber can be a dual-edged sword for a lot of people. For some people, fiber can really cure constipation issues, make things a lot better. But for others, fiber can make them really bloated, distended. They don't feel so good. It actually may make them not want to eat a healthier diet. A lot of it has to do with what type of fiber that you take, but also where are you getting the fiber from. So the best evidence for fiber comes from what's called soluble fiber. Soluble fiber is the type of fiber that you want to try to reintroduce into your diet. And sometimes getting synthetic fiber, fiber that's not made from plants, may be the best option for some people. So for example, Metamucil or Citrusel are synthetic fibers, soluble fibers that have psyllium, P-S-Y-L-L-I-U-M. These are the fibers that typically don't cause a lot of bloating, a lot of gas, and a lot of distension. But what I tell anybody who's trying to introduce fiber is to go low and go slow. One of the more problems that people have is that they try to reintroduce fiber too much, too quickly, but with that they don't introduce water as well. So you really have to have that water to help bind up that stool and get it flushed out of your system. And so if you're having issues with fiber, try going to a synthetic fiber that's over the counter like Metamucil or Citrusel, add some water to that, and also go and try and drink more water, but go low and go slow. Then over time, you'll be able to have better fiber, and hopefully you can have better bowel habits as well. All right, let's go to some of these live questions here. So Max Perez asked a very good question. When should I get pain in the rectum checked? Well, I'll tell you, Max, the answer is you should get it checked, because pain in the rectum can be due to a lot of different reasons. For some people, it could be hemorrhoids. Hemorrhoids very commonly can cause pain, especially if you have a thrombosed hemorrhoid that's there. It's a clot that's there. Number 2, you could have what's called an anal fissure, which is a tear in the bottom that very commonly feels like shards of glass in your bottom when you're trying to have a bowel movement. And that can occur if you're having constipation, pushing for a long time, sitting in the bathroom for a long time as well. Number 3 is that you can have an ulcer in your rectum as well. And that ulcer can cause irritation. It can be a consequence of constipation, and it can get worse and worse and worse. But also one of the things that we worry about is there's something growing inside that colon, because sometimes rectal pain can be a sign of something bad like a cancer that's going on there as well. So my suggestion is if you have rectum pain or pain in your bottom, you need to get it checked and need to make sure it does not get ignored. It's a very great question, Max. All right, perfect. So question number 4, I got this question actually from a DM. Hey, Dr. Islam, why is my poop very, very small? All right. So let me know if you guys have suffered from something very similar to this as well. And let me talk to you, let me kind of give you the lowdown on constipation. So when it comes to constipation, here's what you need to know. Size does not matter. Oh, yes, but it does not matter. If you have small bowel movements, and it's been that way for your whole life, not a big deal. That's not a big deal for me. If you have very large bowel movements, and it's been that way for your whole life, not a big deal at all. Here's where the issue that comes in. If you have a new change in bowel habits, so it used to be large, but now it became smaller and pencil thin, that's what matters. Or if you have bowel movement issues and you're not feeling like you're completely emptying everything out, you're not happy with those bowel movements, that's what matters. Size does not necessarily matter, and frequency, more importantly, does not matter as well. You don't need to use the restroom every single day. You don't even need to go once every 2 or 3 days. If you go maybe a couple times a day or once a week and you are happy and you are comfortable and you don't have any issues, that is not a problem at all. That is very okay. When it comes to constipation, the issue becomes how comfortable are you? And so if you go every single day, but you're not comfortable, you don't feel like you're getting everything out, that's a problem that we need to fix. If you go once a week, but you're very happy with that, you don't have any issues, that's a problem we don't have to worry about at all. So I don't want you to worry about size unless you have a new change in the size of your bowel habits, because that's when it becomes a problem and that's when it becomes an issue. Great question. All right, Marcel, you have a very good question. I've been suffering from chronic constipation. I have to rely on laxatives. Is taking laxatives excessively harmful? So in general, so Marcel, I don't know the specifics of your health in particular, but I'll tell you, for most people, laxatives are very safe. Laxatives have been used for a long time, especially if you've had chronic constipation. There's very little downside or harm in terms of taking laxatives. Now, there are some laxatives that you can get more, your colon can get used to, but by and large, things like Miralax or stool softeners are very safe, very effective, and can be a very good way to help you have more effective bowel habits. But the biggest question I want to ask you is why? Why are you constipating? What is going on? Because it's more important for us to find the answer why you're having your issues. Do you have an issue like irritable bowel syndrome or slow transit constipation? Do you have a problem with the rectum muscles? Is it not working correctly? Is there something growing inside your colon making things worse? These are things that we want to use. But in general, for most people, it is very safe to use a laxative. But my thing, I want to make sure that we want to find out exactly why. So for my investigation, if I can find out why, then I can safely say in your case, it is safe to use a laxative. But I actually am doing the workup to find out exactly why that is the case. All right, Michelle, kind of along the same lines. Hi, is it normal for me for poop to not be formed for weeks or months? Am I missing something in my diet? I've been exercising and keeping my healthy diet. The urge to go is always stronger than the product. It's a very good question, Michelle. So you're right, exactly right. So, it's hard to know exactly what that could be. So for some people, feeling the urge to go may not get you a good bowel habit. And for people who tell me that, what the problem that I think in my head is going on is what's called pelvic floor dysfunction, meaning the rectum muscles are not working appropriately. And this is a very common problem that I see often in my clinic. In fact, this is the number one reason why people have constipation that are not responsive to laxatives or over-the-counter treatments. And the problem is not the colon. The colon's working fine. The problem is that the rectum muscle is so tight. So the best analogy I have is that it's like having a toothpaste, but the cap is closed. So no matter how much you squeeze that toothpaste, nothing is going to come out if that cap is closed. It's the exact same thing when it comes to problems of pelvic floor dysfunction. No matter how much you squeeze through the colon, if that rectum is tight, nothing is going to pass through. And a very common symptom of that is the urge to go, but not being able to use the restroom. And there are tests that we can do to see if there's just a problem for that, and there are treatments for that. So just like I hurt my muscle, I have to go through physical therapy for that. With that muscle in the rectum, you have to go through physical therapy, and the data is excellent in terms of treating that condition with that. And so that's what it sounds like that may be going on, and there are different ways that we can do to test for that and to treat that as well. Great question. All right, this kind of goes on to the last question, Dr. Islam. Is it normal to poop only 2 or 3 times per week? So kind of going along the same question I just answered, the answer is yes, that's perfectly normal. So the normal, what is considered medically normal, is 3 times per week. But like I mentioned before, I don't want any of you guys to worry about the number of bowel habits. That's not the important thing. The important thing is to determine, are you comfortable with how you are going? If you go two or three times per week, but you're happy with it, you're like, this is great. I feel good. I don't have a lot of pain. I don't have a lot of bloating. I don't have a lot of distension. That is exactly what I want to be okay with. Not a problem. But if you go every single day, but you still can't go and you're having issues, that becomes a problem. So size or frequency should not matter. It is how you feel after you have a bowel movement. All right, guys, these are some great questions. I want to thank you guys for being on today's video. I know it's not my typical poop tip Tuesday. We did it on Wednesday, but you know, I have to go with the time. So I'll let you guys know about a couple of updates. Number one, I will be not here for my Poop Tip Tuesday next week. So next week, there's not going to be any more Poop Tip Tuesday, but the following week, we'll be back on again. Send me questions, send me DMs, subscribe to a weekly newsletter so I can see what questions you are and so I can hopefully answer those questions for you guys. But if you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks like we're doing in today's video. Guys, hope you have can't speak. Hope you guys have a great and happy day. Hope you guys have a great St. Patrick's Day. And I hope to see you guys not next week, but the week after. Take care, everyone. Thanks.